Welcome to Novant Health in Focus. I'm June Baker, and today I'm here to meet Dr. Phillip Khan, our Novant Health plastic surgeon. I'm so excited to see you, Phillip.
Thank you so much for coming in. It's always great to spend time with you, and it's always exciting to be able to tell everybody in our community what we can do to help them with plastic surgery.
Absolutely. Well, I'm really excited. I want to show the community the procedure room, and then we'll sit down and have a little conversation.
Excellent. Let's go.
Okay. Thank you. Wow, this is a really nice office, Phillip.
Yeah, they've given us, we have a lot of space, a lot of space to be able, a lot of rooms to be able to see quite a few patients at the same time so that we can kind of maximize efficiency for the patients and be able to see many more in a given day.
How many exam rooms do you have?
On our side, we've got 3 to 4 exam rooms, depending upon what we're using them for. And we also have a procedure room where we're able to do some simple and basic procedures for folks.
Great. Are we headed that way now?
Absolutely. Yes,
okay,
ma'am.
Great. Great. Thank you. Wow, this procedure room is awesome. Looks like you could do a lot of stuff in here.
We are able to do a lot of things in here. You know, we have some great lighting, we have great natural lighting, and we have a nice surgical table to be able to really work things with in terms of our seating.
Right.
And that allows us to do things like treating skin cancers, that allows us to do some basic hand surgery procedures. And it allows us to do some cosmetic things as well, whether that's working on the eyelids. It can be as simple as Botox and fillers, or it can be something like doing small little surgical procedures. We have a wide array of things that we're able to do to provide more convenience for the people in the community.
Right. Now, I know you're a plastic surgeon, and we often talk about plastics, but you do a lot of other kind of surgery, like you just mentioned, hands and different things, correct?
Absolutely, yes.
I know we primarily want to talk about sun damage and things like that, and we can do that in a little while, but I wanted to know what other uses there are for this room.
Absolutely. We do many things, like I said, small little hand procedures, little things such as removing moles and things such as that as well. And we even do some of our breast reconstruction things like expanding, putting fillers in our expanders and putting saline in expanders, all a part of the process. This is kind of our central focus location to be able to do everything.
Right. You don't always have to go to the hospital, right?
Absolutely.
Great. All right. Let me see the room where
go to our
all
big
the
consultation room.
Yeah, let
Let's
me
do
see
it.
that, because a lot of things go on in there.
Absolutely.
Well, today, Dr. Khan, since it's summertime, I really like to concentrate a little bit on sun and sunscreen and sun protection. So there are several methods of sun protection. So let's talk about those.
Absolutely. The number one thing with sun protection is to primarily accomplish 2 main goals. Number 1 is to prevent skin cancer. Number 2 is to prevent aging. Because the sun really has damaging effects because of what we call ultraviolet radiation on our skin. And it's key to protect ourselves from that, because we can't just stay indoors or out of the sun all the time. We've got to live our daily lives. We've got to go to work. We have to have some recreation.
Drive a car.
Absolutely. And there's not one definite answer to be able to protect ourselves. That's why it's important to use things such as sunscreen, clothing that's protected from the sun, avoiding peak hours in the day of the sun, as well as using things such as shade in order to maximize the benefit that we can get so that we don't get that damage.
Right. And that damage occurs early, correct?
It's a cumulative effect over life. It starts at a young age. Even one sunburn can predispose us to skin cancers later on in life.
Wow. That's a lot. And you did mention clothing. How about those shirts that advertise UPF? Is it UPF?
Absolutely. Those are great protective factors that have been done and endorsed by many skin cancer societies based on their ability to block out the sun. Typically, there's a label that we see on those that allows us to provide protection, and it boils down to having more tightly woven factors, tightly woven fabrics, ones with darker colors, ones that may be a little bit more reflective in order to protect ourselves from those damaging rays.
What type of skin cancers do you typically see from the sun?
The most common skin cancers we see, which are the most common cancers worldwide, are things such as basal cell cancers, squamous cell cancers, and then ones that many people are aware of called a melanoma. They come from the damage of the sun and the body's ability to change how they protect themselves from the sun. With that being said, it's important to have these protective factors because it's cumulative through life. It's not just from one big day at the beach. It's that walk to the mailbox. It's that walk in the parking lot at Walmart or at a grocery store.
Right.
So we want to protect ourselves at all times.
I assume there are different methods of removing those types of skin cancers. Is that correct?
Yes, there are. Yes, there are. Some methods don't require surgery at all. Some of those methods are things, you'll hear things called, I've got my lesion frozen off, or I've got my lesion burned off.
Yes.
Those are typically things that our dermatologist colleagues really perform.
Sure.
Other ways of removing skin cancers, which are more typical to plastic surgery, are the treatment of them, removing the cancers themselves. That is, for lack of a complex term, cutting them out and then closing up the hole we create when we do it.
Yeah.
Some of that is us really becoming a part of a team where we're just reconstructing a defect that maybe the dermatologist has removed the cancer, and we do that.
Oh, yeah. The reconstruction sort of after the fact.
After the fact, yes, absolutely.
Yeah.
Absolutely.
Well, talk to me about how a patient gets to see you, the referral process. What does that process look like?
Now, there are quite a few ways that they can get in touch with us. The most typical way is they get a referral either from their primary care provider or even maybe the dermatologist in the area. What we see is that someone will say, I've got this lesion that just doesn't heal. I've got something that I shave over that bleeds and won't heal.
Yeah.
Absolutely. And so typically their primary care provider will say, we'll refer you to plastic surgery. With that being said, if someone has a concern or something such as a focused area they like to be seen, they can call our office directly as an option. The one thing that we don't do in our practice is the full body surveillance.
Right.
We leave that up to our dermatologist colleagues for that.
Correct.
And we're available for spot lesions or to be able to treat those areas.
So a referral from their provider, their primary care provider, would be a great way to go.
Absolutely.
But if they want further information, they could call your office.
They can call our office directly, most definitely.
Okay. Well, lots of great tips today. And before we close, is there anything else you'd like to let us know?
I would just like to tell everyone that just to protect ourselves. You know, there's not a right answer to protect ourselves from the sun's damaging rays. And so those are things that they can do. And also let people know that we have such an incredible way to provide for patients, whether that be ourselves doing it primarily as the plastic surgery team or combining with other providers such as dermatologists or our incredibly talented surgical providers in the Novant system in the area as well.
Great. Well, thanks so much for being here today. And as always, we love seeing you.
Thank you so much. It's always been a pleasure.